you are new to Medicare this year or you just need a refresher course, this is the one video to watch. I am going to go over Medicare Explained. Everything that you need to know about Medicare is coming up. Medicare is confusing, so if you're finding learning about Medicare to be a little bit tricky, you are not alone. They don't make it easy. Hopefully this video is going to help to explain Medicare in a simple way that you'll be able to understand. So by the end of watching this video, you're gonna feel like you have a grasp on how Medicare works. My name is Stephanie Apt. I am a licensed independent Medicare insurance broker. And my team and I help people all across the country to understand, navigate the world of Medicare. In this video, we're gonna go over the parts of Medicare, how they work, how to enroll in Medicare. We're going to talk about when to enroll in Medicare and when not to. Some people are not going to want to enroll in Medicare right away. And we'll review the Medicare costs, monthly costs, as well as some of the hidden costs associated with Medicare. And we'll also go over how to find Medicare plans. There are a lot of different types of Medicare plans. We'll review how they work and how to find the best plan for you. So when we're talking about the parts of Medicare, there are four main parts: Parts A, B, C, and D. Part A is your hospital insurance. This is going to help cover things like inpatient hospital stays. Part B is your medical insurance, so like your doctor's office, outpatient, that's covered by Medicare Part B. Part C is an optional part of Medicare. This is also known as Medicare Advantage. So not everyone on Medicare will get Part C, and we'll talk about that more in a moment. And Part D is the prescription drug component of Medicare. So that's going to be what's covering your prescriptions when you go pick up your medications at the pharmacy. Medicare is a federal health insurance program for folks 65 and over, and certain people under 65 with disabilities. If you're collecting Social Security disability benefits for 2 years, then you're automatically enrolled in Medicare Parts A and B. But most people will be eligible for Medicare on the first day of the month that they turn 65. There's a trick here. If you're born on the first of the month, you're actually eligible for Medicare the first of the month prior. Now, most people will want to enroll in Medicare when they are turning 65, when they first become eligible. There is what you call an initial enrollment period window. This is a 7-month window that starts 3 months before the month you turn 65. It includes your 65th birth month and lasts up to 3 months after you turn 65. And this is when most people will want to apply for Medicare. And in fact, if you don't apply during this window, you may face penalties if you don't have other creditable coverage. If you're collecting Social Security benefits before you turn 65, typically it has to be at least 4 months before the month you turn 65, then the government automatically enrolls you in Medicare Parts A and B. You don't have to actively enroll, and they'll also send you a notice where you can fill it out and send it back if you don't want Medicare yet. But if you're not collecting Social Security benefits yet as you're approaching turning 65, then you can apply for Medicare online. That's kind of the easiest way to do it. You go to ssa.gov/Medicare. There is a blue button on the website that you're going to click to get started. And it's a pretty simple application. It takes most people less than 10 minutes to move through. Once you've completed the online application for Medicare, you can actually check back to get the status of your Medicare enrollment by logging back into your ssa.gov account, going to My Benefits, and clicking on your benefit verification letter. Medicare will approve your application, and then it takes about 4 or 5 weeks for them to actually send you your red, white, and blue Medicare card in the mail. But usually a couple weeks before you even get your card in the mail, you will be able to go back into your ssa.gov account and access your Medicare number and your Medicare approval that way. If you don't want to apply online, you also have the option of calling Social Security and enrolling over the phone. Now, not everyone will want to apply for Medicare when they first turn 65. In fact, if you're actively employed and you have health insurance through your employer, or if your spouse is actively employed and you have health insurance through their employer plan, and the employer has 20 or more employees, you plan to keep working and stay on your employer health plan, then you can delay Medicare without any penalty. And typically you'll want to delay Medicare until you either retire or come off of your employer group plan. I have another video I'm going to link in the show notes below that talks more about why and how to delay your Medicare enrollment and what to do when you actually are ready to enroll in Medicare if you are waiting until you retire past age 65. So be sure to check that video out if you think this may apply to you. When you complete your enrollment in Medicare, whether you're doing it online or over the phone, you are going to be enrolling in parts A and B of Medicare. That's what we call traditional Medicare. And like we reviewed before, part A is your hospital insurance and part B is your medical insurance. So part A is going to cover things like inpatient hospital stays, skilled nursing care, and some types of home health care. Part A is free, $0 per month for most people, as long as you've been living, working in the United States for 10 years or 40 quarters. So you don't pay a premium typically to be enrolled in Medicare Part A. However, there are costs associated with Part A services. If you go into the hospital, you have an inpatient hospital stay, you have a $1,632 inpatient hospital deductible, and that's not an annual deductible. It actually resets every 60-day benefit period. So if you have more than one hospital stay in a calendar year, you may be subject to meeting this deductible multiple times. Once you've been in the hospital for 60 days, you do have a coinsurance amount of $408 per day that you're responsible for days 61 through 90. And beyond that, you do have lifetime reserve days. You'll pay $816 per day for the lifetime reserve hospital stay days. If you go into a skilled nursing care facility, Medicare covers the first 20 days in skilled nursing. After that, for days 21 through 100, you are responsible to pay $204 per day. It's important to note here that skilled nursing is different than long-term care or custodial care, which Medicare does not cover. So when it comes to Medicare Part B, this is your medical insurance. It's going to cover things like doctor's office visits, outpatient care, preventative care, ambulance, and many non-self-administered medications are also covered by Medicare Part B. Things like chemotherapy, certain types of injections and infusions that you receive in a provider setting, those things will typically be covered by Medicare Part B. Many people are surprised to find that Medicare Part B is not free. So you do have a premium for being enrolled in Medicare Part B. The standard Part B premium this year is $174.70 per month, although it could be higher if you are a high income earner, and I will show you those figures in just a moment. All Medicare approved preventative care is covered at 100%, so you don't pay any type of copay or deductible for that. However, for the other Part B services, you do have an annual deductible of $240 per year. After that, it's 80-20. Medicare is going to pay 80% and you'll pay 20% of covered Part B services. It's important to know that there is no cap, no annual maximum out of pocket on that 20% that you're responsible for. Like I just mentioned, some people will pay more for their Part B premium based on their income. Medicare looks back at your adjusted gross household income from 2 years prior, and that's how they determine these figures. These are the income-related monthly adjusted amounts, also known as IRMA, for Medicare Part B, and I'll show you the Part D figures as well. Medicare will let you know in advance if you are subject to IRMA and how much you can expect to pay based on what Medicare has on their file for your income from 2 years prior. Also linked a video in the description below all about IRMA and how to appeal it. And here on the screen as well, you'll see the figures for IRMA for Medicare Part D. So everyone enrolled in Medicare Parts A and B has a choice to make, a pretty important choice to make about how they'd like to receive their coverage. So we haven't yet talked about Medicare Part C, Medicare Advantage. This is where we're going to talk a little bit about that. We're going to talk about how it compares to traditional Medicare as well. So we're going to start here. This is when you're enrolled in Medicare Parts A and B. You've signed up for Medicare. You know you have to pay your Medicare Part B premium, and whichever path you go down, you still have to continue to pay your Part B premium generally. Let's start over here with traditional Medicare. So if I'm choosing to go down this path, then I'm keeping my Medicare Parts A and B benefits as my primary coverage. I can always go to any doctor that accepts traditional Medicare. I don't have any networks that I need to worry about, in network, out of network. Either my doctor accepts Medicare or they don't, and most doctors do. From here, I'll decide if I need to add on a Medicare Part D prescription drug plan. Now, Medicare Part D drug plans can vary quite a bit, and we always recommend choosing a Part D drug plan based on the current medications that you're taking. I have a video below that shows you how to look at your current medication list and run it against the different various prescription drug plans available to you in your area to help figure out which drug plan will be the best for you overall. Medicare Part D drug plans can and do change from year to year. So this is something that you don't want to just set it and forget it. You want to really pay attention to how your plan changes so that you can shop it as your needs change or as the plan benefits change every year. In most parts of the country this year, Part D drug plans start as low as 50 cents per month or $0 per month in some states. So there are some very inexpensive drug plans available to you, and they can go up in premium as well. There's plans that are $30 a month, $50 a month, $100 a month. And with Part D drug plans, it's kind of a little tricky. It's not always like the more expensive plan is just the better plan. It really varies depending on the medications that you are taking. So that's why it's very important to do a thorough Medicare Part D drug plan search and make sure that you're choosing the plan to best meet your needs. Finally, you'll decide if you want or need a medigap or a Medicare supplement plan. These are the plans that fill in the gaps in traditional Medicare that we just reviewed. So these are the plans that are going to help pay the 20% that Medicare doesn't pay. They're going to help pay the hospital deductibles when you're inpatient or your skilled nursing facility fees. Medigap plans pay most of those gaps so that you are left with little to no out-of-pocket responsibility. The nice thing about Medigap plans is that they also don't have any networks. So traditional Medicare is still your primary insurance coverage. Your doctor, hospital is billing Medicare first. Medicare approves the claim, and then as long as Medicare has approved it, your Medicare supplement plan automatically must pay on any claim that Medicare has approved. You don't have to file any paperwork, and you, again, are left with little out-of-pocket responsibility. So these plans are very popular. It's important to know that Medicare supplement plans typically only give you one open enrollment period, only one, and it's not every year, it's just once when you turn 65 or when you're going on to Medicare Part B for the first time. So that is the best time to choose a Medicare supplement or Medigap plan because you can have your pick of any plan with any insurance company and you're automatically approved. If you wait until you're not new to Medicare anymore, then in most states, these plans can require medical underwriting to get approved. That means that the insurance company is going to look at your health history, they're going to ask you health questions on your application, and then they're going to decide whether or not you're approved for coverage. So you can apply for a Medicare supplement plan at any time during the year. However, you're only guaranteed that approval during the first 6 months that you are new to Medicare Part B. Now, there are some other states that have different rules and regulations about Medicare supplement open enrollment periods, and I've linked another video below that talks about state-specific rules. So the nice thing about doing this path is that you are maintaining that provider freedom. Like I mentioned before, there's no networks that you need to worry about, and you also have very complete coverage for any Medicare Part A and B coverage service. The downside is that you do have to purchase a separate Medicare Part D drug plan for prescription coverage and a separate Medicare supplement plan to go along with your traditional Medicare benefits. And additionally, Medicare currently doesn't cover most dental or vision or hearing services, so those things are not covered by your Medicare supplement plan either. The alternative option here is to choose Medicare Part C, also known as Medicare Advantage. Medicare Part C Medicare Advantage plans are an alternative way to receive your Medicare benefits. So you're still enrolled in Medicare Parts A and B, right? You're still paying your Part B premium, but now you've enrolled in a managed care plan through a private insurance company that is offering you your Medicare health benefits. So when you go to the doctor and hospital, you don't show them your red, white, and blue Medicare card anymore. They don't bill traditional Medicare. They are now billing your Medicare Advantage plan. In most parts of the country, Medicare Advantage plans are available from as low as $0 a month. How can they be $0 a month? This is because the government actually pays the Medicare Advantage plan for every person they enroll. Because once you're on the Medicare Advantage plan, traditional Medicare, the government is not paying your medical claims anymore, right? Your Medicare Advantage plan is. So because of this, Medicare pays the Medicare Advantage plan for every person they enroll, and they are then able to offer the plan to you from as low as $0 a month. Additionally, many Medicare Advantage plans include Part D prescription drug benefits rolled right into the plan, and they also include some extra benefits. You might see plans that offer dental or vision or hearing services, things like transportation, extra benefits that you may not see on traditional Medicare. However, there are some downsides to be aware of on Medicare Advantage. Specifically, these plans do have networks. Most plans will be HMO or PPO plans, meaning you either have to use in-network doctors, there's no coverage out of the network, or you may be able to go out of the network but pay more if you use out-of-network providers. Medicare Advantage plans can and do change every year, so your doctors may not always be in the network, the plan benefits may not always stay the same, and when you have a Medicare Advantage plan, you are responsible for set co-pays and co-insurance amounts that the plan establishes for certain services. So you may have a co-pay for every office visit, or a co-pay for every hospital stay, or a co-pay for every diagnostic test, etc. And those amounts can vary quite a bit depending on the plan that you choose. And many Medicare Advantage plans can have maximum out-of-pocket limits that you are responsible for that are up to $8,000 a year or more. So you really want to review the plans. Again, they can vary a lot to help determine which type of Medicare Advantage plan would be best fit for you. It's important to know that if you start off with a Medicare Advantage plan and then later on 2, 3, 4 years down the road, you want to switch over to traditional Medicare with a medigap plan, you may or may not be approved for that medigap plan in medical underwriting. It's going to depend on the state that you live in and your health. So you want to know that while you can always start here and then go here later on, Medicare Advantage plans are available to anyone on Medicare Parts A and B. There is no medical underwriting involved. You can't always start here and go here. It will depend typically on medical underwriting. That being said, it's not to scare you away from Medicare Advantage plans. For many people and in many parts of the country, these plans can be a great fit. It's just very important to know because many people think they can just flip-flop from year to year, go back and forth and choose whichever plan works best for their needs that year. And unfortunately, that's not always how it works. So when you're trying to figure out which type of plan is best for you, your needs, and your budget, it can be a little confusing. It's not always cut and dry. There are lots of things you want to take into consideration. Things like your health history, your family's health history, your monthly budget, how often do you use your medical insurance, etc. So this is the type of thing that we help our clients with every day. We help thousands of Medicare beneficiaries to find and enroll in the best plan for their needs. Our service is completely free of charge. And this is how I make my living, by helping people, many of who find us right here on YouTube, call my office, and we walk you through the process to determine which plan is going to be best for you. We handle your enrollment for you and make it hopefully an easy and seamless process for you. Additionally, my team is here to help you with policy service and support throughout the year if you have billing or claims issues. And again, our service is free. We're licensed in almost every state and we work with dozens of different insurance companies. So we're able to offer an unbiased view on helping you choose the plan that will be best for you specifically. I'd love it if you decide to give us a call. I hope that you found this video helpful in going over the Medicare basics, Medicare 101 for 2024. Please don't hesitate to reach out with questions. Share this video with a loved one or someone that might find it helpful, and leave any questions for me below in the comments too. Thanks so much for watching, and we'll see you soon.